Heritage Radio, the beacon of hope.
Assalamu alaikum wa rahmatullahi wa
Everyone, good morning.
barakatuh. Sorry, we're always a little bit trying to get to grips to all the technology here.
Yeah.
You should see feels like the cockpit of a Boeing
Video.
747. So please bear with me. We ask for your patience. We have some interesting discussion today, don't we?
Our topic today is about type 2 diabetes and the NHS Low Calorie Diet program. Our guest speaker is a lovely Dr. Natarajan. She's a GP in Trafford, and Derek Schofield from Stockport, and he is a patient that's completed the program that the NHS offers.
So we have Dr. Natarajan on the phone, and Derek is here with us in the studio. Hello, Doctor. Can you hear us?
Yes, hello. Good afternoon.
Good
everyone.
afternoon. Thank you so much for coming on and talking to us about this really important health issue. So we're going to start with you.
Yeah, can you tell us, Dr. Natarajan, for our audience, what is diabetes? T2 diabetes, type 2.
Yes. See, diabetes is a serious condition where your blood glucose, which is blood sugar levels, are too high. It happens in type 2 diabetes. It happens when the body is not producing enough insulin, or the insulin produced is not effective. So if we take our body is made up of building blocks called cells. The cells need energy in the form of glucose to be active. So when we eat or drink, the carbohydrate, starchy food gets broken down into glucose in the gut, and then it goes into the bloodstream so that the cells can use that glucose as energy. But it is not as simple as that. We need a hormone called insulin to take the glucose from the blood into the cells to be used as energy. So the insulin is produced by an organ called pancreas in our tummy, which is above the belly button. So when the blood sugar goes up, the pancreas senses it and it produces insulin, so that the insulin takes the glucose into the cells to be used as energy. Okay, what happens in type 2 diabetes is, because there is not enough insulin produced, or the insulin is not very effective.
Okay.
In people with type 2 diabetes, there is insulin resistance. The cells are resistant to the insulin.
Okay.
And so it doesn't make it work.
Okay. So, Derek Schofield, you had type 2 diabetes?
Yes.
And are you Dr. Natarajan's patient?
No.
Okay,
I'm a different surgery.
So, Dr. Natarajan, can you tell us a bit about the NHS Low Calorie Diet program and how it can put the type 2 diabetes into remission?
Yeah. The NHS Low Calorie Diet program has been started last year. It was based on the direct trial and droplet trial, which was done. The direct trial was done in 2017. It involved...
Okay.
Sorry,
go ahead.
It was involved in 49 practices, primary care practices in Scotland and Tyneside. There were 306 people were recruited who had diabetes diagnosed within the last 6 years, and half were given the best diabetes care as usual, and the rest half were enrolled into the weight management program. And they found the people who were enrolled in the weight management program, at the end of 12 months, 24% of the participants lost 15 kilogram in weight, and 46% achieved remission of diabetes compared to 4% in the control group. Diabetes remission means bringing the blood sugar, which is HbA1c, within the normal limits over a 6-month period without any medication.
Okay.
So it was a huge success in the primary care. So based on that, NHS England has rolled out in different areas in England, and one is our Greater Manchester, the Low Calorie Diet program.
Okay. So now we're going to ask Derek
Hi,
a
Angela.
question. Hi. How are you?
Good, thank you.
We talked a bit before we get into the studio. So, Derek, how did you find out about this NHS Low Calorie Diet program?
So, when I was diagnosed when I had a blood test with type 2 diabetes, and I was actively trying to change my lifestyle and monitor my progress through my GP. So every 6 months or so, we were taking new blood tests to see if my blood count, sugar levels were going down, whether my habits were changing, were working. And then it was the nurse that I was doing that 6 months check with that said, there's a trial programming that's going to happen. And I think that you're the kind of person that will stick to the program. You set goals and you want to achieve them, and you're serious about wanting to, put your diabetes into remission. So I think you're a good candidate for the program, and that's why she put me forward for it.
Well, that's good.
So I'm interested to know why did they particularly think that you were a good candidate for the program? What was the criteria?
Because when I was diagnosed with it, I was in shock. I didn't realise that I even had type 2 diabetes. But when he explained to me what it was, how it could damage your health, the implications of having type 2 diabetes, I was serious about wanting to change my lifestyle to basically get rid of it. So she could see my commitment. And that's why I said I want to see you every 6 months. I want to have my bloods tested regularly, and I want to see that I'm improving by doing the things I need to do. And then she could see that I had the commitment and I had the drive to do it, and thought that the program would help me to get that achievement even better and faster.
So that's one of the criteria, is basically that you have to be really committed, and you have to want to do it. And,
you have to be aware of and one of the things they have to do, they give you they have a discussion with you beforehand to say, are you aware that this is what you're going to need to do, especially TDR, total diet replacement. You're going to need to refrain from everything, food and drink that you would normally have. And do you feel you can do that? Because if you can't, then there's no point. No point.
How long was the were you told how long the program was going to be for?
It's 12 months.
So you knew that for 12 months, a whole year, you would not be able to have your normal food.
12 weeks is the TDR. So 12 weeks is total diet replacement, where you have nothing but powdered shake. So there are things you can do. If you are struggling, you can have non-starchy vegetables. So there are things to help you. But if you really want to commit, then you have to have nothing but 4 shakes a day, and they're just powdered shakes. Nothing at all. No sugar. No milk in your tea. Nothing. So absolutely nothing.
So you have to be very, very committed, very sort of diligent,
regimental. Yeah.
Are you allowed some leeway? You talked about having starchy vegetables or something too. I guess it's because of that. Personally, I would think, and probably lots of our listeners would think that pleasure we have in crunching things with our teeth.
Yeah, that's really hard, because all you're doing is, putting some powder into a container, putting some water into it, shaking it, and then drinking it, and you do that 4 times a day, and then you get nothing else. So if if you struggle, and if you find that people around you are eating and that you're not, then fine, you can get some carrot and some broccoli and those kind of eat as much of that as you like, because it doesn't produce any sugar, so that's fine. So if you feel you need something to help you along the way, but for me it was just all on, go in and just go for it, and that's what I did. So
did you struggle? How was it?
For me, it wasn't too bad, but I had the advantage of being in lockdown. So, COVID lockdown, so I couldn't go out. I didn't have the temptations, only at home. What I did was I kept myself really busy, but then I was doing things like a lot of DIY, a lot of stuff around the house, keeping moving all the time. But then when I started thinking, I need to eat something, because, the family were eating, and the daughter would come in with a takeaway or something. I'd think, oh, no, that's not helping. The smells.
Right.
So they would go, they would come in with a takeaway and think, well, I'm going to need to do something. So I would go out and I'd, into the kitchen, I'd get some carrot, and I'd chop up some carrot and munch on a carrot stick or something. And then after that, I'd feel like fine then after, Did
you find yourself, you actually went towards the takeaway and just smelt it?
No, I avoided, I just avoided it, yeah. And what I also did was, to be fair, I didn't ask the family to do anything differently for me.
Fair enough.
But if they came in with a takeaway, I thought, well, what can I do then? So I just got the dog and went for a walk.
Yeah.
I thought I'll just
So
I'll get out for 20.
Responsibility.
Yeah, I had to do
fantastic.
something to get myself away from it.
I mean, some of the things you say can relate back to when we fast as Muslims. Sometimes in the family there will be someone who picks up illness or something. They can't fast, or you have young children, you have to cook for them anyway. You eat, you see them eat and everything. Yeah, there's kind of that moment you're like, especially the sort of midday and 6 p.m. sort of usual meal time, and you're like, it would be time for me. I'd love to have something, but because I think you probably put yourself in that mindset where I can't. I will not.
I will not do it.
Therefore, although the temptation was here, you were able to control it because you had such an important goal to achieve.
Yeah, and I deliberately gave myself a routine. So I would, I'd have my shake at 9 o'clock in the morning, then I'd have my second shake at 1 o'clock in the afternoon, then I had my third shake at 4 o'clock in the afternoon, and then I had my last shake at 6, 7 o'clock in the evening. And I've stuck to those times. So my body or my mind was saying, this is when you're going to eat. This is when you're going to have your shake. And therefore my body wasn't thinking, oh, you're not, it was just, you knew what you were expecting.
Yeah.
So it's like a timetable.
Sure.
And as long as I was within those kind of timetables, it helped me really well.
Right. Okay. And did you get support from the program? Did they have someone you could
lots
call
of support.
in and talk? How does it work?
So you have a dietitian there's about 6 or 7, maybe a few more of you on the program. So you have you use Microsoft Teams because obviously with COVID there was you couldn't do a group anymore. So we all connected on Microsoft Teams about every 2 or 3 weeks initially. When we started the program, so we were on the calls and we were there and we'd go through all these different training modules and presentations, and the dietitian would help you along the way. You'd get a call in the morning before you went on the call individually to say, what are your readings? Because what you did every week was you took a reading, you took your blood sugar level reading and you took your weight reading. So you could see yourself, going down or whatever. So she would, and then they would ask you how you're doing. Is it okay for you? Are you struggling? So you got that kind of support at the time. And then on the calls with the people, you could actually, give each other some advice that anything you learned. So I was learning how to be regimental with my times when I'm having my shakes. And also, people saying, well, some of them had soups. I didn't like the soups personally. So they would say, oh, I put in so-and-so in the soups to make the taste better. So, some non-starchy vegetables. So they were giving ideas on recipes of what to do to make it more enjoyable. So it's really good.
That's good.
Yeah.
Right, so we're going to bring in Dr. Natarajan back for her sort of side of the story.
Dr. Natarajan, tell us now, what does the program involve?
All right, okay. See, before that, I would like to mention one thing, how the program helps people achieve remission. Most of the type 2 diabetes patients are either overweight or obese. So they carry fat not alone outside their organs, but they carry fat in their organs as well, like pancreas and liver. So they are not able to work properly. By losing weight, and they lose fat outside their organs, also inside their organs. So the pancreas and liver can start to function properly. Pancreas can produce good amount of insulin. So that's how it works. This program involves 1 year. It is a 1-year program. The first 12 weeks is a total diet replacement program. They are given shakes and soups in the first 12 weeks. After 12 weeks is a food reintroduction phase. They will give guidance of introducing food into their diet. They also help them with some physical activity, behavioral change, and after that is a weight maintenance phase for 6 months. They will be supported by a diabetes practitioner for 1 whole year.
Wow.
There will be initial one-to-one assessment, and then there are 20 sessions with the diabetes practitioner. They will also be provided with a well-being app. There are 39 online support modules. At the end of 12 months, there is a final one-to-one assessment.
And all this is provided by the NHS?
NHS, it is free from NHS.
Okay, as long as you qualify and you're on the program, the NHS pays for it. Okay.
That's right.
What results are you seeing from your patients that have accessed the program?
Okay, so far we have seen some fantastic results. 100% of the participants achieved weight loss at the end of the food replacement, which is around 16 weeks. The average weight loss was 14 kilograms, and a lot of people had a reduction in their blood sugar, which is called HbA1c levels. They were also able to reduce their medication, not alone for diabetes, also for blood pressure medication.
Oh, that's very interesting.
Yeah, that's right.
That's really good.
Yes, yeah.
Okay. Sophie, do you want to ask anything?
I think it would be important for our listeners to know, because I'm sure a lot of people listening are getting increasingly interested and intrigued by this. So how can they be referred to the NHS? I mean, we've heard Derek's story. Is that a standard story that basically you just turn up at the GP and you ask to be referred, or are you doing something more proactive from your end to identify the patients who could benefit?
Yes, in the general practice, the practice nurses, healthcare assistants, GPs in Greater Manchester are aware of the program. And every practice had one member at least who went in for training. And they identify patients because there is a certain criteria. They should have been diagnosed with type 2 diabetes less than 6 years. And they should be between 18 to 65 years of age. And their BMI should be over 27. But it is over 25 for ethnic minority group. And so there are some certain criteria. And also they should not be on insulin. They should not be pregnant or planning pregnancy in the next 12 months. So there is a list of criteria. Okay. So when these patients come into the general practice, even for other ailments, the practitioners identify those patients and give information to them about this new low-calorie program. And they give information, and there are patient information leaflets available as well. And we send some links to them so they can go onto the website and have a look at the video links.
That's great. We will give the website. We can give it now and repeat again afterwards for people. And as usual, listeners, you can always email us at info@heritageradio.org.uk. If there's anything you haven't managed to write down, we will pass on the details. But for now, if you want to go, Angela, you will read out the...
it's Xyla Health on the phone number 033 577 3561, and Xyla Health is Xyla, Xyla, and the website is xylahealthwellbeing.com. Xyla Health and Wellbeing.com. Sorry about that. Now, if you want to know how to spell it and all that, you can call into the studio or email us at info@heritageradio.org.uk. But we'll mention it again at the end, so keep your pen handy so you can write down the spelling. Okay.
So finally, doctor, because I know the GPs are generally very busy and your time is precious. So just a final question, Angela.
Yeah. What support do you provide to patients who don't speak English?
Okay. So there are some Hindi and Urdu sessions available as well. And the group is starting on 19th of April. When we do the referral to the program, they ask the question, what language do they speak? Do they understand English? So at the first consultation with them, the patients are asked whether anyone else can support them while attending the group sessions.
Okay.
So there are additional language groups, or whenever needed, the Xyla Health will be able to accommodate. But the Urdu Hindi group will be available from 19th April. The information will be provided in English, but there are some well-being apps which is available in Urdu and Hindi as well.
Is there anything in Arabic as far as you know?
Sorry?
Is there anything in Arabic as well as far as you know?
Not currently, I think.
Right. So mainly Urdu and...
Yeah.
Okay.
In Urdu and Hindi, but if you ring Xyla Health, they will be able to help you with more information regarding languages.
Fantastic. Dr. Natarajan, you're a GP in Trafford. Thank you so much for your time, for explaining everything to us. It was very interesting and an eye-opener, and we'll continue our conversation with Derek a little bit after our short break.
Thank you very much.
Heritage Radio, the beacon of hope.
Assalamu alaikum wa rahmatullahi wa barakatuh. We are back. So today we're talking about diabetes type 2. We had a lovely doctor on, Dr. Natarajan from Trafford, who explained to us the NHS program, which is this program where they replace meals with shakes and seems to be a lot of support for people who want to lose weight and get in a remission from type 2 diabetes. But we also have Derek Schofield from Stockport, who's started to tell us a little bit about his experience on being on the program. But this, the doctor mentioned a lot of the fact that, she mentioned a lot obesity, losing weight and everything. But when we look at you, and you told us you actually you were not at all obese or overweight when you had your diagnosis of diabetes type 2. And I think this is really important for listeners to hear, that you can look good on the outside but not be healthy inside because what you eat is actually not beneficial to you. So can you tell us a little bit more about how you were and all of this? What led you to?
I mean, I've always been active. I'm 53 years old now, but I play football once a week. I play golf once a week. So I've always been quite active. An active person. And I describe myself, I'm 5'4", so I'm a little bit chubby, but I wasn't obese in any way. But so I was fairly active, but my lifestyle, my traveling lifestyle, my eating lifestyle, I didn't realise that the things that I thought were good for me, because I was spending a lot of time in hotels with my job. And so I was waking up in the morning and going for breakfast thinking, well, let's not have the bacon and the eggs and everything because that's unhealthy, because that's, cholesterol. So, stick to fruit because fruit's good for you. So I was having melons, I was having strawberry, yogurt, pineapple, bowls and bowls of stuff, and I like the flavor, I like the taste in it. I thought, well, I could just get full up on this, and I don't need, bacon and eggs. And
so that would be first thing in the morning, and for several weeks.
For a month, because I was always away for a month, and so that was my breakfast, and then I'd eat normally, normal meals I would have, but I didn't realise until I went to the doctors and we had the diagnosis, that when they said, what is it you've been doing? And I went, well, I've always been, healthy. I've always been eating healthy, more than my 5 a day. And they said, what were you eating? And when I told them what they were eating, they were in shock. They went, no, that's natural sugar.
But it's still sugar.
It's sugar. Yeah. It's natural sugar, and it's not, and your body's not going to be able to cope with getting rid of, with doing enough to burn that out. So that was the real shock that came in, and thinking you would have actually been better off having scrambled egg and bacon or something, more regularly than having fruit every morning. And that was the reason why, we discovered that, I thought I was being healthy, but I wasn't. And I didn't have physical signs. People were saying to me, oh, you've lost weight, because they hadn't seen me for a while. And I was taking it as a compliment, thinking, oh, great. And they said, what have you been doing? I went, nothing really. I've just cut down on a little bit of sugar and eating healthily. But so I was seeing that I was losing weight, but didn't realise that I was losing weight without trying. And that was a sign of being diabetic. And it's not good. It wasn't clever. And I didn't realise that. I just thought I was being, being healthy.
So crucial what you're saying, because aren't we always told have your 5 a day?
Yeah.
And that always include fruits, and they always put the picture of like an orange, an apple. But we don't realise how much sugar these contain.
Yeah.
So if you have an apple, one apple a day, occasionally here or there, but if you have 5-6 types of different fruits loaded with fructose is the actual sugar, isn't it, Angela?
Yeah, that's
Tell us a bit more about what fructose does.
Fructose is the one sugar that your liver can't deal with, and it causes the problems. It comes from fruit, whereas glucose, it deals with it better.
Right.
But fruits have the glucose and the fructose together, and that's what causes the problem. Now, if you tell, a lot of people have the idea that fruits are all healthy for you, but
it's moderation that's important.
It's good to meet people like you, Derek, because it's from experience. It's not just in a book or theory that you have this problem.
So what were the signs that, if you don't mind telling us?
Yeah, it was. I didn't think there was anything wrong because with me, I felt fine. I was never ill. I never felt bad, and it was my wife that said, because I've been working away all the time, and I'd be away for 3 or 4 weeks at a time, and then eventually she said, "There's something wrong with you. It's not right. You're gaunt in your face. You're no longer chubby in the face, and you've lost a lot of weight." And she knew that I wasn't doing anything to lose weight. So she said, you can't just lose that amount of weight, without trying. That's not right. There's something wrong. And typical male, I was like, no, I'm fine. There's nothing wrong with me. I don't feel ill. There's no need to me to bother the doctors. And,
what's a doctor?
What go see? Yeah. So she said, no, I'm going to make you an appointment to see your GP.
Clever woman.
And, and I was like, well, there's no need. And I kept putting it off. And then eventually she said, it was almost like, it's you or the GP. So I eventually went to the GP. And he said, what are you doing here? And I said, well, I don't want to waste your time. Typical thing. I know you're busy, but, wife told me to come here because she says it's not right. And he said, you look okay. Let's weigh you. Let's just check your weight, your BMI. BMI was kind of fine, a little bit overweight, but not too much. And then he said, well, let's just, for precaution, take some blood tests. And then when he took the blood test, I walked away from there thinking, nothing's going to happen. I'm fine. And, I've wasted their time, but, at least I've tick the box and the wife will be happy.
Yeah.
And then 2 weeks later, I get a phone call to say, we need you in immediately. Wow. And then I was in hospital that night, overnight, stayed in hospital because they went, your HbA1c count for type 2 diabetes, if you're 48 and above, you're in that type 2 diabetes range. I was 111 and didn't know. I was dangerously, in that type 2 diabetes range. So I had to immediately do things. They put me on medication straight away, and then I had to completely change stop eating fruits and stuff. So yeah, it was a real shock because the only symptoms I had, was I was drinking an awful lot, just juices. I was always thirsty.
Right.
Juices, though.
And so you were drinking
it was the only things. It could be anything. I don't actually like water. It's too bland for me. But I was drinking orange juice and, thinking again orange juice is good for you. But I was just drinking gallons of this stuff, and I was always and I was drinking lots of tea, coffee when I'm working during the day, and I would go through so many cups of tea a day.
Was it with sugar or just?
No, I actually wasn't drinking sugar in my tea at that time. I'd stopped, but I was still drinking lots. But then I was having stuff like, Tango or something. I was having fizzy drinks. So to try and get rid of my thirst. So I kept drinking that, and I was always going to the toilet, always going for a wee.
Yeah, those are signs for diabetes.
Yeah, and I didn't know. So, it was like, it was, and because I used to work in I worked in a team and we worked away, and I was in an office environment, and I'm going for a wee, and everybody would laugh. He's going for another wee, and even they didn't really realise. No,
we don't know this thing.
So now, myself, if I see my friend, for instance, if he for there and he's constantly going to the toilet, I say, you okay? So you can see the signs, but I never saw that, and my wife never saw it when she saw that I was drinking, drinking fizzy drinks a lot. She didn't see that. It was the fact that she saw I was losing weight without trying to lose weight, and that was the main symptom. Another one was tiredness, but I put the tiredness down to the fact that I travelled a lot,
jet lag and
stuff, and it, so I was making the excuse that that's why I'm tired without realising.
What manifestation of that tiredness were you just lethargic, or you were just sleeping a lot?
Sleep a lot. I'd be tired in the morning, and I'd get up, but struggle to get up.
But I wouldn't feel refreshed.
I wouldn't feel so refreshed in the morning when I'm starting work. It'd take me a couple of hours to get out of that grogginess and then be active and and concentrating. Hard to concentrate, and my job was I was an auditor, so I had to concentrate and do a lot of writing and stuff and report writing. So it took me a while to I was forgetting things as well. So yeah, it was odd that I never saw the signs, and I didn't even know. I never even looked at type 2 diabetes. When I looked at it, he said, when they told me, they gave me a leaflet to say, this is why you've got type 2 diabetes, read this. And I was like, oh my word, this is me. Everything it says that is a symptom I have, all of it. And I was like, I didn't know. I never knew this at all.
So next time your wife grates on your nerves, remember she saved your life.
Oh, yeah.
If she's listening, you clever woman.
Yeah.
You did not listen to your husband. You went to do the appointment for him. We know. We all can all relate to that.
And then and they tell you, they say that my eyesight, your eyesight deteriorates, and I had 20/20 vision up to the age of 40 something, and then I'm 43 now, and my eyesight has just gone. Over the last couple of years, I've had to wear glasses, which I never had to wear, so that could have been a factor, and they would, I now have to have regular eye tests every once a year to see whether there's damage to the back of my eyes, because diabetes can damage your blood, your tiny blood vessels, and my feet, and have to be checked and all those kind of things. So it was quite scary when you realise what the implications can be.
Yeah. I think Derek, it really is. We're so grateful that you came, because, as I said, you are not the typical person we would think would have this issue, and that's now, you can talk about it, as you say, you can see it in your colleagues and friends and family. You can, you have now that knowledge, and thank you for telling everyone. So, what are you doing now? So, how long ago was the diagnosis when you went into the program, and now how long since you've been?
Yeah, it would have been around 2019 when I had the diagnosis, and I went, so straight away, as soon as I found out I had type 2 diabetes, I said, right, the nurse at the GP services said, right, we're going to monitor you now every 6 months. We're going to bring you in for new blood tests and see whether your blood sugar level counts are coming down, what they call HbA1c. So that went down to, I think it got it down to 70 something, which is still too high. Then I got it to 45, and then I'm like, right, I'm no longer diabetic, and this is great. And and I was on medication then, so the medication was helping, and then we said, right, let's keep going and see how we carry on. And it was going up again to 56 and back down again. So we were monitoring it, so I was doing everything I can possibly do to change my diet, be more active, walk more, exercise more, avoid carbs, for instance. So I was kind of doing that kind of thing. And then it's when she said, when this program came out from the NHS, it was a trial, and she said, because I'm committed, because I realised how important it was, that's when she said, I think you'd be good to go on this program, because I think you will benefit from it. Because it was never an issue about weight, because I wasn't overweight, and I wasn't too big, but it was a fact I was, I had the diabetes. But it was a good way of, by losing weight to help you to achieve it, because weight does have a factor on it.
Of course.
And so what I found was, when I went on this, what they call the total diet replacement, so the shake program for 12 weeks, I couldn't believe how quickly I lost weight. It was amazingly fast. In fact, I actually lost too much weight. I went from 75 kilograms to 58. So, and then people were complaining, saying I didn't look well, because I was very gaunt then and very thin. And when I spoke to the nurse and the dietitian who monitors you on the program for the 12 months, I said, I've actually got 58 kilograms now, and people are complaining that I don't look well. I'm really, really skinny. And then he went, well, and the dietitian said, well, you're going to finish your TDR, and then you're going to eat food, you're going to reintroduce to food again. You are going to put some weight back on, and then you'll level off. So your BMI is 64 kilograms, so you're 58. To put on 2 kilograms is very, very easy.
Yeah, very true.
So what I found was, it was rewarding that you knew you lost weight quickly, but you also you feel very active and fit again. You can do things like, I play football once a week. I have done for 20 odd years. I play 7-a-side with my friends, and I was running faster than I was running before, and I couldn't believe it. And even my friends were saying, you're like a coyote. We just can't catch you when you've got the ball. You were never like that. You're a completely different player.
So good.
I just couldn't believe. And then I felt like I was running faster, and I felt like I was playing better and everything. Yeah. And what I also found was, once I'd lost that weight, it was very easy to maintain it. So. And this is what I always said, because you're on these group calls every 2 weeks with a dietitian, and you give each other tips, and they give you, with the program, they give you your blood glucose testing kit, and they give you a set of scales, and they give you the shakes. And so those scales, I weigh myself every day, and I have done ever since. for the whole year. Every
Keep an eye on your weight.
you get up in the morning, you have your shower, whatever, you brush your teeth, and just put your scales in the bathroom. It takes 10 seconds to get on the scales. It's not going to, it's
you
10
can
seconds.
have those ones that actually record
Yeah.
your weight the day before, 7 days before, 30 days before, so you can see the trend.
Yeah, so religiously now, if I brush my teeth in the night, I brush my teeth every morning. So why not just jump on the scale in the morning? Never mind, not at night time, because when you've consumed everything.
Yeah, you can have a
but
glass
in the
of water.
morning, in the morning, I put myself on the scales, and if I've gone up 2 kilograms, 1 or 2 kilograms, I go, right, that means I now need to behave in the next 2 days, because I can just get it back off again straight away.
So now I'm talking about behaving. What are you doing? What are you not doing? Are you reverting back to eating everything, or are you careful?
I'm careful. So if I know I'm going, and say for instance I'm going for a meal in the evening with friends, then I'll eat light during the day. I won't have big meals. And even if I'm going out for the meal, then I'll make sure that I'm careful what I do eat. I eat in moderation. So if it's, for instance, you're going to have a burger and you're going to get fries with that, then just don't have the fries. Ask for a salad instead, just something to substitute it. So if I'm having a curry, then I say, well, do I really want the chapati and the rice, or can I just do without one of them? So not have the rice, but or if I'm going to have both, just have it in smaller portions. So portion sizes is really important. So I do that. And then during the day, if I'm, if in the morning I think, do I need toast? I don't really have to have toast. That's carbs. And if it is, if I'm going to have some bread, do I need white bread? Because that you can't burn those calories off quickly, where the calories are in your body very fast. Whereas if you have brown bread, then you can, whole grain bread, then it takes longer for the carbs to build up in your body, and by that time you probably burnt them off. So it's choices and portion size and stuff like that I do now. So, fantastic. But also, if I know I'm going to socialise, if I know I'm going to go out with the friends and have a few beers in the in the evening, then during the days before that, then be healthy and do everything, and the days after that, do something, be more active. And I know winter time's been, and we've had a lot of rain, and I've not been able to go out, for instance. So now the weather's changing. The dog will be happy because it doesn't get 1 walk a day now. It will get 3 walks a day, because the weather's better. So I just do all of that now. I'm conscious of moving more, doing more, and being, just taking away that temptation to eat the things that you can have them. You can have chocolate, but just don't have. But you can have everything you want, but just in moderation and be careful with it. Is what I've done.
And a final question, like your friends, you go out with, and were they support? I'm sure they were supportive, but do you get a bit of banter because you have to be careful, and blokes don't like to be careful about anything? There's
the one story I can tell you is I live in Stockport, and I've meet some friends of mine quite very occasionally on a Saturday in Edgeley. So I live by the airport. So up in Hill Green, and I used to, my wife on a Saturday used to drop me off at my local pub where I'll meet my friends and we'll have a few beers. So from starting the program over a year now, I don't care if it rains, snows, whatever, I walk from my house to where I'm meeting my friends. That takes me over an hour and a half. It's 4 miles.
Wow.
Because I know I'm going to have 3 or 4 beers with my friends. But when I get there, the first thing I've done, I've just walked 4.5 miles. So I'm thirsty.
Yeah.
Now, the worst thing I can do is now drink a pint of lager, because that's going to go into my body pretty quickly.
Yes, there's a lot.
So what I do is I sit down with the guys, and I'm there with a black can of water. And they're saying, what are you doing? What's going on? Are you drinking a beer? So I'm going to have a beer in a minute, but I've just walked in from 4 miles. I'm really thirsty. I know that pint is going to go down too quick. It's not going to be very good for me. So I do those kind of things. So you get the banter.
Educating them a little bit and breaking those sort of barriers about talking about health and everything. Because I know men, we could talk about health, among women for,
And if they say, well, what are you doing drinking blood bag? I'll say, well, because I can walk 4.5 miles on a Saturday and you can't.
Yeah.
So,
And Has anyone around you then, those friends have started thinking, "Ooh, maybe I should have a look at what I'm doing," or not?
No, I
really,
don't. Well,
no.
they've been they've been supportive of me
course.
and understood it, but I don't. Well, my friends don't have type 2 diabetes, so they
Yes.
probably think they don't need to.
Most people
but
only think really when they're faced with the actual problem with themselves. Yeah.
Yeah, and the motivation for me was, like I say, it was really avoiding medication as well. I really don't like having to be medicated, and if you've got type 2 diabetes, you need to have medication to help you with that. So when I finished the TDR, for instance, we had the HbA1c, and I was out of the range of type 2, but only just. And I was like, I've just spent 12 weeks having nothing but shakes, but my blood count is 46 when 48 is type 2 diabetes. And they said, well, that's because your body isn't coping very well with sugars. It's just your makeup.
Yeah.
But, so it's not, it's remission. It's not getting rid of it.
Like
it's remission. So so now, because I do all the things I do, because I walk and I'm more active and I care for the portion sizes and what I'm eating, I don't have to rely on that medication every day. If my blood sugar levels are high, take some tablets, but I don't have to have, I used to have 2 tablets in the morning, 2 tablets at night. I don't have to have that now.
Right. It's only just in case.
It's only when I need to.
Occasional moment, which is brilliant, which is the way we should all
You're
be.
the perfect patient, though, right? Because you have a problem, and then you figure out how to solve it, and then you do it instead of waiting for others to medicate you to feel better. Because a lot of people are waiting for the experts to tell them what to do, and they don't want to, and they see what they're going to miss. But not having the roti or the rice or the bun is not a problem when you have your health to look forward to, right? But other people are concentrating on what they can't have, and that's I guess plays into why they can't cope with and trying to get into remission, because it is something you can do, and that's really good to meet you.
Yeah, thank you. And it's really easy to, once you realise by doing these things, you get the benefit and you feel different. You feel like you can, and you feel independent.
Right? Like, I can do this.
Exactly, and you feel like independent. It's like independence. It's like if my friends want to have a laugh with me and saying, "Why you're drinking black kind of water? What's going on?" I think, well, because I've just walked 4 miles and you didn't do that. Yeah. I'm independent. I'm better than I'm better.
You don't. Medication kind of keeps you dependent. To something.
Yeah, I don't need that medication anymore.
Really
and it's a really good feeling that you've achieved it. But and that's why, and it's a program that they put out that they want to do this because
a lot of people. To get on to the.
And it will help the NHS as well, because if more people take this program on and get the benefit of it and aren't reliable on the meds, then it's saving. It's better for everybody. But,
Definitely. Wow.
Yeah, it's very inspiring. But from a point of view of mindset, I can see why they thought you were a good candidate, because it seems to be you already have that mentality of like you want to take things in your own hands. Generally speaking, you're not like someone who just feed me with whatever. I don't want to do anything. You have to have that mentality to do such a drastic change. You're the kind of like a cold turkey person, aren't you? Kind of just, I need to do it, I'll just go for it.
Yeah, and one of the things, they teach you all these different tricks, and when you're on the program, when you're on these 2-week sessions, you go through these little presentations and these what they call modules, and there's so many things you can learn about things like virtualization and mindsets and tricks and habits, what bad habits are, like I was saying earlier about, if you're watching TV and an advert comes on, stand up and walk out the room. And
you don't
have to watch the adverts, because if you're not bothered about buying stuff, why would you do that? And just really simple habits and and simple things to do. And virtualization, if you're going to go out and virtualize, picture yourself what you're going to be, what it is you want to achieve and how you want to do that. And it really was useful. Things that I'd never ever considered before.
You were probably already doing it, though. You just didn't realize. If you are successful at your work, you probably were doing that.
Yeah. Just applied it to the health side of it. Yeah.
Well, Derek, I have to say, you opened my eyes, and I hope that our listeners are going to kind of, think about these things as well themselves. Maybe, as you said, they might not have any symptoms, but just look at, for instance, how much sugar they have. Yeah. We, in this show, we constantly encourage people to replace their refined sugar anyway with alternative sugar that are healthier or none. remove them completely if you can, and also to have like not as many carbs, but
reduce
you know,
your carbs, especially refined.
Yes,
because vegetables are carbs too.
They're
the kind that don't produce
exactly.
sugar
I was,
that fruit does.
we were encouraged to, on the program you can have non-starchy vegetables, so broccoli and carrot and those kind of things, coriander. They're all good for you, so they, and that's the sort of stuff I was having, and like I say, you don't have to, get rid of everything and not have these things. You can have an apple, but sometimes just think, well, maybe a carrot is just as useful.
Carrots can be just, especially the raw one.
Yeah, exactly that. Yeah.
So we'll have to just repeat the details. We promised we'll do that at the end of the show. So if you want to find out more about the program that Derek was on, because either you think you might have some issues of diabetes type 2, go first to your GP, obviously, get your blood tested, go and speak to them. They're the experts. But if you want to find out more about how this program works, because you're already diagnosed with type 2, then you can contact Xyla Health, and that's Xyla, and the number is 0333 577 3561. So that's 0333 577 3561. And the website is xylahealthandwellbeing.com. And as you know, you can always email us here at info@heritageradio.org.uk if you couldn't quite catch that. Derek, it was lovely having you. Thank you so much for your time.
Thanks, Sophia. Thanks,
Such
Angela.
an important message. And we wish you all the best for the future.